Hello, my name is Chelsea Solaris, and my portion of muscular dystrophy was about its etiology and pathogenesis of it. So what is etiology and what is pathogenesis? Well, etiology is the cause or set of causes of a disease, also where it originates from. Meanwhile, pathogenesis is more of the pattern of development or the process by which an infection leads to a disease. So first we're going to talk about where did muscular dystrophy originate. Well, the first case was reported in 1836, where two brothers were developing generalized weakness and muscle damage at the age of just 10 years old. At first, this was looked at as symptoms of tuberculosis since MD was not discovered yet. A French neurologist named Guillaume Duchenne wrote about his first case of MD, which later on he gave a comprehensive amount of 13 patients with this disease in 1868. The most common form of MD was followed by his name. So what causes muscular dystrophy? Well, certain genes are involved in making proteins that protect muscle fibers, which now MD is occurring when one of these genes is defective. The most common MD is caused by a mutation in the gene that encodes the cytoskeletal protein, which leads to muscle degeneration. This prevents the body from producing dystrophin, which is the protein essential for building and repairing muscles. So without dystrophin, muscle cells cannot maintain their structure. And people inherit these genes mutations from their parents, but it can also occur at conception. Mothers can actually transmit to their son even though the mothers themselves are unaffected by MD. So inheritance patterns include sex-linked, autosomal recessive, and autosomal dominant. Sex-linked includes Duchenne, Becker, and Emily-Dreyfus, and this is when a mother carries the affective gene on one of her two X chromosomes and passes it to her son. This is the most common, and it is a 50% chance of the child getting this type. So Duchenne and Becker is generally affected to boys due to their X and Y chromosomes. Meanwhile, girls have two X chromosomes. So if a girl inherits the faulty gene, the other healthy gene can compensate for the mutation. So autosomal recessive includes limb-girdle form, and this is when both parents must carry and pass on the faulty gene. And this is a 25% chance of the child getting this type. And lastly, autosomal dominant includes FSHD and ocular, and this is when the child receives normal genes from one parent but a defective gene from the other. And this is also a 50% chance of getting this type of MD. So now we learn more about muscular dystrophy and about its etiology and pathogenesis. Thank you.